This complementary therapy is increasingly popular as a way of treating a whole range of baby and toddler problems. Teething, windy or irritable babies can all be helped, as many new parents swear by osteopathy as a way of helping common ailments. So how does it work?
If you think about all of osteopathy, paediatric osteopathy is just osteopathy. We're doing it on small people who are slightly different to big people, but it's the same principles. So osteopathy is really looking at structure and function and movement. So what we're interested in is how the structure affects the function, how the function affects the structure, and how everything moves in relation to everything else. And so what we're doing is looking at those complex relationships, whether it's with the bones of the head, which is sometimes something that we'll focus on with babies, or whether it's if you've got a baby who doesn't crawl properly, whether it's through the bones of the pelvis and how the lower extremities, the legs, are actually moving and how that's affecting the balance through the pelvis, or how certain muscles are affecting that balance. And if a baby comes out, for example, that's been quite compressed or quite tight and quite tightly packed, then certain areas may be compressed and that can affect movement and balance. If they've had one leg very tightly tucked up, that can affect the hip balance. So we'll be looking at all of those things, assessing all of those things, and then very gently encouraging the body to correct, because everything has a blueprint for health. And what's lucky for us is that babies are very much closer to that blueprint than we are as adults. We haven't had all those years of falls and knocks and postural bad habits. So with the baby being that close and with a child being that close, it's a lot easier to re-establish that health and the patterns for movement that baby already has.
Karen Carroll is a consultant paediatric osteopath at the Osteopathic Centre for Children, based in North London and Manchester. It was set up as a charity 15 years ago to make paediatric osteopathy available to all children, regardless of the family's financial circumstances.
Well, we don't turn any patients away because they can't pay. Patients are asked to pay what they can afford, and some patients pay a few pounds or nothing, and some patients pay more than that. I don't know what our average donation is, but patients are just encouraged to pay what they can pay at the time.
All osteopaths undergo 4 years of medical training, and at the OCC they also complete a 2-year diploma in paediatric osteopathy. The minute you walk into the centre, you know you've come somewhere that puts children first.
Nothing's too much trouble. Come here, everything's done at the child's speed. It's very unstressful, very non-invasive, unlike physiotherapy where they're pulled and pushed where they don't want to go.
He's just so much more relaxed, and he used to cry all the time and he doesn't, and he's starting to use his arms more, and he just loves being here.
It's like a magic work. I don't know what they do, I don't know how it happens, but that's the results.
Taking an alternative route when your child has a health problem can be a bit daunting, and it's often hard to find guidelines outside of seeing your GP. Osteopathy, however, is now so regularly used and so often recommended by doctors that it's virtually mainstream. What isn't so well known is just how beneficial osteopathy can be for babies and children.